We have a very clear focus on adolescents with bipolar disorder and adolescents that are at risk for bipolar disorder. And the reason that we focus on this group is that it's a highly impairing condition, fourth most disabling worldwide for teenagers, highly familial, so it runs in families. If you have a relative with it, you're at higher risk, and responsive to a combination of medicines and therapies. What we don't know yet is what causes the illness, and we don't yet have biological markers that give us an objective sense of how is a person doing symptomatically beneath the surface. In other areas of medicine, such as cardiology and oncology, if you're a patient in a clinic, you have an interview with the doctor, they take a history, they examine you. But in addition to that, they have objective tests that can help them make decisions. We completely lack that in psychiatry, and the emphasis of our group's work is to try to rectify that and identify clinically relevant biological markers. The theme of our biological markers relies on an association that's been observed between heart disease and bipolar disorder. So heart disease is the most common cause of death in society overall, but among people with bipolar disorder, this happens prematurely. So if there's such a strong connection between bipolar disorder and heart disease, can we try to derive benefit by finding connections between bipolar disorder and vascular risk and use those biological markers, use those imaging measures to help us decide on which treatment to use, when it's working, and when it should be stopped. We think that there's a lot of stigma that remains against mental illness, in particular bipolar disorder, and in particular among youth. We think that there's a subset of society who as yet is unconvinced that these are truly medical disorders, and that by identifying the biology of bipolar disorder, this will reduce shame and this will increase help seeking, and therefore, if those things are true, people's outcomes might be better. So we want to get the shame away and the recognition that even though you don't see blood, even though you don't see a broken limb, that this is still a valid and meaningful medical disease. I think Sunnybrook is an ideal hospital for the type of work that we want to do because it's multidisciplinary, and it's truly multidisciplinary. So we have collaborators in cardiology, radiology, anesthesia, ophthalmology, and it's one thing to have the inclination to work with all of those different partners, but to have an institution that supports it and encourages it is, I think, completely unique.